My name is Dr. Luis Raez. I am the medical director at Memorial Cancer Institute, that is part of Memorial Healthcare System in South Florida. And I also professor at Florida International University. The FDA recently approved pembrolizumab in combination with chemotherapy for new patients with stage 4 or metastatic non-small cell lung cancer. This important breakthrough is based on a small study, a randomized phase 2 study, published or presented, because it's not published yet, by Merck, that basically shows that there is a benefit of adding the immunotherapy agent pembrolizumab to the conventional chemotherapy carboplatinum base. This is very important because until 3 weeks ago, the only way that a patient can get immunotherapy in the front line was if he was able to have the PD-L1 marker expression in the tumor more than 50%. So that was the only approval for immunotherapy as a single agent for new patients. Thanks to this approval now, the patients not only can have the pembrolizumab, but also they can have chemotherapy at the same time with the idea to improve response rates and progression-free survival. So that is a very important landmark approval, but it's not based on a phase 3 randomized study, so this approval has to be verified, is conditioned to a phase 3 study that is ongoing, that needs to be finished, and the results need to be presented to see if this combination of pembrolizumab with chemotherapy is going to be our new standard of care. That is why it's not embraced by all the doctors yet. And the other important thing to remember is that in this approval given by the FDA, patients don't have to have the 50% staining of their tumors with the marker PD-L1. If you remember, as I said at the beginning, if you want to have pembrolizumab as a single agent, as a new patient, you have to stain more than 50% of your tumor with the PD-L1. If you're going to use now pembrolizumab with chemotherapy, we don't need the stain. It's approved for people that has a high stain, more than 50%, of people that has less stain, less than 49, 50%. That's a very important difference. The other thing is we already have 6 other immunotherapy agents in development, at least, and we are with a lot of expectation waiting to know what is going to happen with the other immunotherapeutic agents that hopefully some of them will be able to be moving to the front line.